Hi, this is Dr. Eric Donor at the New York Skin and Vein Center. Today I'm going to be demonstrating how we treat spider veins. Okay, so spider veins are those tiny little veins. They can be dark blue, they can be bright red, and all colors in between. They are not varicose veins, which are a medical problem. These are a cosmetic problem. And most women have some spider veins on their legs. And the way we still get rid of spider veins in 2017, 2018 is sclerotherapy. It's still the most efficient way to get rid of spider veins. So sclerotherapy is injecting the veins with a medication to irritate the inside of the vein. It collapses on itself, can't carry blood, you don't see it anymore. Now, one of the problems that most doctors who treat spider veins get into is that they don't treat the underlying cause. And it's very important to use an ultrasound to look for the feeder veins into the spider veins on the surface. If you don't do that, you can run into problems and have real troubles getting rid of the veins themselves. So we use ultrasound to look underneath the surface. For the bigger blue veins, we treat them with a stronger medication in order to seal them shut. Then we work on the spider veins. Okay, so there's several principles that are involved in treating spider veins that you have to follow. So right now, what I'm going to do is I'm going to be treating this big blue vein under the surface that's feeding into all of this, and this patient is going to Jamaica in 8 weeks. So we should be able to help her quite a bit. So besides the ultrasound, other things that we use are special lights that make the veins show up properly and make my job easier. All right, so right now I'm going to be injecting a stronger medication into the vein in order to seal it shut. And we use an FDA-approved product called sodium tetradecol and polydecanol. And they're the most widely used substances in the world, and they're very safe. Nobody who knows what they're doing still uses concentrated saline or the saltwater injections. And the reason you don't is because salt water causes ulcerations and hurts like crazy. And it's not approved by the FDA. So right now what I'm going to do, and I've already cleaned off her leg, is we're going to be injecting this. And so some medicine got in there. And you can see she's not screaming or yelling or crying because it doesn't really hurt. And then my assistant's going to hold this for me. And I'm going to get this, and you can't see very well, but I can. There we go. And we got some in. And I'm seeing that it's tracing out the whole length coming down here. All right, and then what we do after that is we take a milder solution and then we go after the little spider veins. And you can see they look a little red and irritated, and that's a normal thing. And then I just go after the little spider veins. And the needle is a 30 gauge insulin needle. It's very tiny. All right, and then we do this. So we chase them all down. So then afterwards, we don't make her wear compression hose because none of these are bulging. So putting somebody in hose won't really help. We do use a special cream afterwards called Dermica to rub down. It helps her heal faster, helps prevent complications. She'll return in a couple of weeks and we'll see how much improvement we got and touch her up. All right, so this is Dr. Eric Donor at the New York Skin and Vein Center. Hope to see you soon.